Good evening. My name is Dr. Renin, and these are my colleagues, Dr. Ace and Dr. Al. And we're going to be discussing tonight with you the epidemic of hypertension in America today, and how it can be controlled through the Renin Angiotensin Aldosterone System, also known as RAS. Now, the way the RAS system works is when the blood pressure falls, the kidneys release renin into the bloodstream, and it binds itself with angiotensin to create angiotensin 1. The angiotensin 1 then binds with angiotensin-converting enzyme in the lungs to create angiotensin 2. Angiotensin 2 does two things. Number one, it is a very strong vasoconstrictor, and it also sends a message to the adrenal gland to release aldosterone. What this does is the vasoconstriction creates vasoconstriction in the kidney, which reduces the blood flow in the kidney. It also reduces the glomerular filtration. The aldosterone, what it does is it increases the sodium-potassium exchange. By doing this, the body retains water and sodium and releases potassium. This all works to increase blood pressure. But when we have hypertension in our bodies, we have medications that can control this system. The first part is the renin. And the type of drug that controls renin is called renin inhibitors, or DRIs. DRIs work to inhibit the conversion of angiotensin to angiotensin 1. The only DRI is aliskiren. That is the only approved one, and is only approved for hypertension. Aliskiren works by tightly bonding to the renin, inhibiting the creation of the binding of renin to angiotensin, and therefore stopping the creation of angiotensin 1. Aliskiren is administered orally and should not be taken with a high-fat meal. It is metabolized in the liver through the CYP3A4 isosome and has a half-life of 24 hours. Aliskiren is generally tolerated. However, there is a slight risk for angioedema, cough, and hyperkalemia. It may also cause diarrhea. Now, if you are pregnant or nursing, do not take aliskiren, and you should monitor your blood pressure daily and immediately report swelling of the neck and face. Now I turn it over to Dr. Rees.
Thank you, Dr. Renin. Now I'm going to be talking to you about angiotensin converting enzyme, also known as S inhibitor. The uses. S inhibitors treat hypertension, heart failure, and decrease progression of diabetic nephropathy. How does this group of drugs work? Just like Dr. Renin rightly said, angiotensin converting enzyme inhibitors block the conversion of angiotensin 1 to angiotensin 2. S inhibitor also reduce aldosterone levels. Blocking angiotensin 2 produces vasodilation, urinary excretion of sodium and water, and urinary retention of potassium. Major classes. Classification is anti-hypertension, and this group of drugs ends in pril, like captopril, lisinopril, fosinopril, etc. Special considerations when taking this drug. Use cautiously in renal impairment, hepatic impairment, hypovolemia, hyponatremia. Monitor creatine and BUN laboratory. Contraindication. Do not take S inhibitor if you are pregnant or breastfeeding because it can cause injury or death of fetus. Hypersensitivity. If you have history of angioedema with previous S inhibitor, S inhibitor may cause lithium toxicity if you are taking lithium for mood disorder. Teach patients to avoid S medication with food, because food decreases absorption of captopril. Before taking ibuprofen or aspirin, talk to your doctor because incest may decrease effectiveness of S inhibitor. And finally, tell your doctor if you are taking any diuretics or water pills, potassium pills, or any dietary supplements. Thank you. As I hand over to Dr. Alves.
Thank you, Dr. Ace. It is important for you to know that angiotensin receptor blockers, or ARBs, are primarily used for treating hypertension. But there are other uses such as treating heart failure, diabetic nephropathy, myocardial infarction, and preventing strokes. ARBs are used to block excess of angiotensin to its receptors in blood vessels, the adrenals, and all other tissues. This results in dilation of the arterioles and veins. It prevents changes in cardiac structure and increases renal excretion of sodium and water. They are all well tolerated but can cause angioedema, fetal harm, and renal failure. All ARBs are taken by mouth and may be taken with or without food. Patients who are pregnant should not use this type of drug if they are in the second and third trimester of pregnancy because it causes fetal harm. And do not forget that they all end with the suffix TAN. Now I would hand it off to Dr. Blocker, but he is on vacation. So I'm going to take his place and tell you what you need to know about calcium channel blockers. Calcium channel blockers prevent calcium ions from entering cells. They are used to treat hypertension, angina pectoris, and cardiac dysrhythmias. They can cause constipation, dizziness, headache, and edema. Calcium channel blockers all end with the suffix INE. It is important to take the recommended dose as toxicity of this drug is easy to reach. The drug must be used with special precautions in patients with cardiac failure and must not be used at all in patients with sick sinus syndrome or second degree or third degree AV block. This will conclude our special interruption to prevent this epidemic of hypertension from spreading to other countries across the world.